My name is Janet McDougall. I'm a public health lead. I work for NHS East Riding of Yorkshire, PCT. Within public health we was actually looking at quite a lot of different training, because the key thing what we wanted to do within public health was to actually build capacity within the community. So we looked at the training programmes that we already had and that were already rolling out.
Yep.
And what we did, we used Making Every Contact Count framework to
Yep.
actually look at the competency level
Right.
around that.
Okay.
So that different organisations could actually see, and different staff groups could see actually what level they were working at.
Good.
So some people it would just be for signposting at that level one,
Yep.
but other people would actually be doing, we had sort of one programme which is active in age, where they're actually leading older people to lead sort of chair-based and life activities, but they're actually trained to do that, so
Yeah.
they'd be operating at more of a level 2. And then we had other programmes such as suicide prevention programmes, etc., where people would be doing more at level 2 and some even going into the level 3.
Right.
So that was quite a clear way for us to actually see this is what we're offering, this is where they fit, and how we can go on and build capacity. Public health is in that transition period, linking in with the local authority.
Yep.
So we're trying to embed it more into policies within the local authority as well, and obviously bids. And this year the cold weather plan has come into this first year that we've had a cold weather plan,
Yep.
and there's been some funding attached to that.
Right.
So within the funding we put a bid in, and actually that bid is around cold weather detectors to be
Okay.
in place in so many households within the East Riding.
Yep.
But what we want is that staff are actually, health staff are actually here actually thinking about fuel poverty, actually thinking when do we need to recognise there's an issue here. And so we're actually looking, and we've linked it with Making Every Contact
Yeah.
Count,
Good.
so that we're actually getting health staff or other social care staff are actually picking up on
Yeah.
that wider determinants of health. So we're using it within that, and that's embedded in the bid.
Great.
That's actually been successful. The other things that we're doing with our health trainers is actually they're actually looking at that we commissioned in some of the healthy chat training, so we've had a wide number of people from different agencies and organisations who have actually taken part in that. And then from that our health trainers have also been trained in healthy chat, are actually inviting members of the public to come and have a healthy chat.
Right.
So we're actually now starting to engage with people and actually thinking, well, they are the people that are actually thinking, actually I do want to make some changes, but I want to just do it quite informally. And so they're actually using that model now and just saying, would you like to come in, it's free, have a little healthy chat, what would you like to change? So we're getting people when they're ready and equipped, they're actually wanting to make those changes. So that's been rolled across the East Riding. And the other, we're trying to link in with other sort of brief interventions as well. Locally as well, we're running an alcohol programme as well. Again, health trainers have been at the forefront of actually delivering that for us on the ground. So they're making they are making every contact count in the aspect that they're bringing up the subject of alcohol, which hasn't always been the first sort of role that you actually bring that into a discussion. We've actually got a lot of evidence where we've actually referred people to the GP because they hadn't even realised that their drinking was at a higher level.
Right.
They actually thought that it was okay. So we're getting some positives. And I think some of the things around with this sort of health through warmth scheme that run in the East Riding is that often people are always making that linkage. Obviously you're not going to get well if you're living in a home that's very cold.
Yeah.
And often people just aren't aware of what schemes are out there and what help there is. And obviously it's just a simple referral.
Yeah.
Somebody then comes and does all the assessment, and then there's a range of different schemes and different benefits that are available for people, and then they're accessing that. They seem to have really taken it on board. They're actually using it in quite a lot. I've noticed that a lot of things now that are coming through from the local authority are actually kicking onto that, making every contact count, because they see that as very, very important for a whole range of different interventions that they're putting on, because a lot of the things that they're looking at now is obviously around independent living, positive ageing, all the sort of things. So we know that if we're making contacts very quickly and signposting people in a timely way, that we're more likely to keep people well.
Right.
So it links up to quite a lot of things that they're doing. They're doing different schemes within the leisure services, around weight management schemes, walking to health schemes, Other things that they're involved is around the telecare and the telehealth.
Yeah.
Other aspects around how do you keep people well with dementia and other aspects. So it's a wide range of different things where we know that if we're getting more people equipped and trained at that awareness level, that we're more likely to be signposting people very timely and appropriately to get that help and support before they deteriorate. We commissioned in one session of Healthy Chat where we trained people at that trainer level. The next is actually we're getting more and more different groups approaching us. We've just had an approach from sort of the youth service around how do they signpost that age group, sort of the 16 plus age group, into sort of making healthier choices. So now we're looking to see would that be a useful thing for them to actually have that Healthy Chat training themselves, and then they can actually look, they're the experts working with that age group, so they're probably the best way to actually, probably the best people to get to engage those younger people in that conversation. So then they'll sort of be better equipped, that they'll take up the opportunities on offer. So what's that sound sort of next sort of step around that? We're also looking at wider, we've had other people like the fire service. They have a lot of support workers within the fire service that actually go and do health checks, home checks really, in the home. In the past I think it was mainly that people thought you just run them and you just got a smoke alarm or smoke detector there, but they do a holistic assessment of the property, and they're keen to refer into different schemes that can help people. They've been actually very key at referring people into services that help with falls prevention. They've also been very active in referring into the health through warmth. They're very keen again to refer people with smoking cessation, because there's lots of issues around people smoking and fire risks and alcohol and smoking. They've actually found that there's a higher incidence now where you're getting, obviously since the smoking ban in pubs and different places, more people smoking more in the home, and obviously with alcohol drinking in the home, huge impact, which is having a other effect that they're seeing that impact, especially on different vulnerable groups of society. So they're keen to get on board with that as well. So I think we've got a wider, there's a wide workforce out there that actually deliver on public health, but often in the past I don't feel I've always felt confident and not aware really about what services exist. And I think the Making Every Contact Count framework is enabling us to actually build on that and enable people to actually act there and then, instead of sort of going away and thinking that might be somebody else's responsibility.